So this is my check off for skin temperature, condition, and color. First, like, getting this information is going to help determine like an athlete's circulation ability, perfusion, so if they're able to circulate oxygen throughout their body, as well as like their body temp. Some locations that you can look for this would be like their nail beds if they're not wearing fingernail polish, otherwise like the palms of their fingers. Their extremities, such as just like their arms or their legs or their feet. Otherwise, you can also look at the eyes, and the sclera will be able to tell you, if there's any discoloration or anything. So one thing that you look at for dehydration, you can look at a skin trigger, which is just pinching the skin and making sure that it bounces back into place. Anything more than like anywhere from 2 to 5 seconds would be abnormal, which would mean some form of dehydration. Other places you can also do that is their forehead, which is kind of hard, and their sternum, which is weird as well. It's just easiest to do it on the back of the hand. So some other things that you're gonna look for is temperature. So you can do this by just using the back of your hand if you don't have anything else available. You can do it with the back of your hand because the palms of your hand are a little like warmer than the back. So you can do it on their forehead, you can do it on their neck, their abdomen, their feet, some of their extremities. You can also like quantify it by using a thermometer. So if you have one available, do like the mouth and the ears are common places in babies. So you can do it like in the armpit. You're also gonna look for color. So if it's like pale or ashy or gray, it's gonna be an indicator of like poor circulation. Blue would be like no oxygen, so hypoxia. Yellow would be like jaundice, so some form of disruption in their like organ. And red would be like the inability to dissipate heat, or like just getting done with a workout or something, you're gonna be pretty red. Some other ones, so like temperature could also be like cool. Having a cool temperature could be like early stages of shock or inadequate circulation. Cold could be like exposure to the cold, like frostbite or hypothermia, something like that. Hot would be like, just getting done with a workout or like exposure to heat. Isolated hot spots could mean like infection or like a sunburn or something. Another thing you're going to look for is condition. So clammy would be like blood flow reduction or shock. Moist could be like sweating, or like could from anxiety, like your palms sweat. Wet could be from like exercise, so from sweating in like excessive amount, or fever, so if you get sick. And then you can kind of like pair all those together to kind of get like a broad diagnosis, or like if your patient needs to be treated for shock symptoms, or if they need to be referred to the hospital or something.